Pyrexia, commonly known as fever, is a natural response of the body's immune system to infection, inflammation, or illness. It is a temporary increase in body temperature, usually above 98.6 degrees Fahrenheit or 37 degrees Celsius. In this blog post, we will delve into the world of pyrexia, exploring its causes, types, symptoms, diagnosis, treatment, and prevention strategies. Causes of pyrexia. Infections. Bacterial, viral, fungal, or parasitic infections can trigger pyrexia. Inflammation. Conditions like arthritis, vasculitis, or inflammatory bowel disease can lead to fever. Tissue damage, injury, surgery, or cancer can cause pyrexia. Immune system disorders. Autoimmune diseases such as lupus or rheumatoid arthritis can result in fever. Medications. Certain drugs like antibiotics or anticonvulsants can cause fever as a side effect. Types of pyrexia. Here are the different types of pyrexia or fever. Low-grade fever, a mild increase in temperature, usually less than 102 degrees Fahrenheit or 39 degrees Celsius. High-grade fever, a more significant increase in temperature, typically above or equal to 104 degrees Fahrenheit or 40 degrees Celsius, like in dengue, also known as saddleback fever. Recurrent fever, repeated episodes of fever, often seen in conditions like malaria and tuberculosis. Relapsing fever, alternating periods of fever and normal temperature commonly associated with borreliosis, also known as Lyme disease and leptospirosis. Intermittent fever, fever that occurs at regular intervals often seen in malaria and Kala-Azar, also known as visceral leishmaniasis. Remittent fever, fever that fluctuates but never returns to normal, often seen in typhoid fever, which follows a stepladder pattern, and pneumonia. Continuous fever, fever that persists over time, often seen in lobar pneumonia and meningitis. Hectic fever, a type of fever that occurs in the afternoon or evening, often seen in tuberculosis and malaria. Pell-Ebstein fever, a type of fever that occurs in the afternoon or evening, with a regular rise and fall in temperature, often seen in Hodgkin's lymphoma. Septic fever, fever that occurs in response to a severe infection, often seen in sepsis and meningitis. Symptoms of pyrexia or fever can vary but commonly include the following: elevated body temperature, sweating, chills, headache, fatigue, muscle aches, and loss of appetite. These symptoms are the body's way of responding to an underlying issue. Diagnosing pyrexia involves identifying the underlying cause, which may require several steps. These include a physical examination, a review of medical history, and laboratory tests such as blood, urine, or imaging studies. Treatment depends on the underlying cause and may include antimicrobial therapy for infections, anti-inflammatory drugs for inflammation, supportive care like fluids and rest for viral infections, and sometimes surgery or other interventions for underlying conditions. Prevention strategies for pyrexia include practicing good hygiene, such as hand washing and vaccination, avoiding close contact with infected individuals, staying hydrated, and getting plenty of rest. Managing stress and avoiding sharing food or drinks are also important steps to take. Pyrexia is a common and important response of the body's immune system. Understanding its causes, types, symptoms, diagnosis, treatment, and prevention strategies can help you better manage fever and maintain overall health. If you have a fever, it is essential to consult a healthcare professional to determine the underlying cause and receive appropriate treatment.